Hello, welcome to the Voyage Clinics podcast. I'm your host, Dr. John Sanders. Today, our special guest is me. The Voyage Clinics podcast, our objective is to bring health and wellness and education to our communities. And today, I'm going to be talking about some of my favorite topics in practical first aid. So this is the title of our podcast today is just Practical First Aid for Families. No pain, no panics. Let's just get through it. So here we go. Number one, I think very, very common. So I've been seeing a lot of stuff. It's summertime where, we're seeing lots and lots of stuff. And so I just want to talk about really common things in first aid for mothers, for fathers, for families, and what do we see and what do we do about it? So number one, let's talk about choking. Infants, toddlers, older kids. Choking is very common. You can have that. My wife and I are musicians, and we were playing at a gig in Moab at the Red Cliffs Lodge. It was just out by the river, and we're playing guitar, and I'm watching the audience, and I see this kid. He's like, I don't know, he might be 10 or 12, and he shows us the universal I'm choking sign, and he's doing this, and I'm playing, and I'm watching him, and his mom is looking right at him, and he's not talking, and she's asking him questions, and he's not speaking, and I'm like, he's choking. So I put down my guitar, ran over there and helped him with it. He had just eaten too big a chunk of steak, and he was choking. So anyway, we saved the day and helped the kid. We just did the Heimlich maneuver, just kind of pulled up on his diaphragm, and he was to spit that steak out. Started with the finger swipe with a pinky, make sure it's not easily swipe outable, which it often is not. With smaller kids, you tend to like toddlers. Let's do infants. So infants, you can flip them upside down. So I'll often palm them like this, and I'm supporting their face with my hand or my fingers. So their face is literally laying in my hand, and I just put their face down, and then you just pat them on the back, and they just cough it right out. So that's the other thing. Obviously, call 911 if you can't get it out. Those kinds of things. It's a big deal. If it doesn't work the first time, try again, right? So keep working and get that thing out. That's totally fine. Choking is very common. Prevention on choking is really, really important. So what do you do? Try to avoid larger food items than is reasonable for kids. Even like small kids, you might quarter or eighth the grapes instead of feeding them the whole grape. A very, very common choking thing is the grapes and little cherries and things like that. Chop them up so that the kids can chew them up and not just try to swallow them and choke. So yeah, those are the main things with choking. Be really careful and make sure kids are chewing their foods and all that stuff. Let's go on to seizures, febrile seizures. Let's talk about fevers first. So what is a fever? Greater than 100.4. Temperature checking is important. Just a tactile temperature, a mom or dad who checks a temperature on a kid's head and it feels warm, that's about 60% sensitive and specific, which is pretty good. So if you feel the temperature on your kid, that's okay, they got a fever. But the most accurate way to check a temp on an infant is like a rectal thermometer. And then on the kids, older kids and things like that, you want to just check them in their ears or their foreheads or their mouths. If it's 100.4 and above, well, you got a temperature, right? And so what is the cause of those? Mostly infection of some kind. And if they have obvious signs and symptoms, runny nose, cough, sore throat, those kinds of things, then it's a viral illness. And you watch that out. At Voyage Clinics, what we do is we're easily available and accessible to our families, and they can text or call us with things that come up, and then we can kind of help them in the moment. That's one of the benefits of having a membership, kind of a retainer process for your doc or your provider. We have 2 wonderful nurse practitioners, a couple of docs, chiropractor. Like we got a whole team of people available and accessible to our patients. So often when a fever comes up, they'll call me and we'll get to the bottom of it and we'll try to figure it out. Is it an emergency? Not really. So especially in smaller, younger kids, they have a very active thymus gland. It's their immune creating gland. So they're creating all kinds of antibodies and learning about, the world and how to fight different bad things in the world. And so it's very common for them to spike fevers because they're immuno-naive. So their immune system's more naive than ours because we've been around the block and we've seen more things. So they'll often spike fevers with just colds that maybe we don't spike a fever with. And we just watch those, runny nose, sore throat. The mucus producing things are often just viruses, and there's a whole bunch of common cold viruses out there, and a lot of them will cause fevers in younger kids. As we age, adults will get fevers, and it's typically more serious, like influenzas, those kinds of things that will knock you down pretty hard. COVID, the original COVID, where people didn't have a huge immunity to it, caused a lot of fevers and stuff. So those are the things. As a fever spikes or drops, especially in a child, it does predispose them to having a seizure, a febrile seizure. And so it's that quick rise or quick fall in the temperature where they can seize. And for parents, it's very dramatic. It's very scary. But a kid who has a fever and who has a little convulsive episode, it's very short-lived. And typically it's just with the rise or the fall of the temperature. And usually they'll call me and we'll reach out and we'll talk it through and, see if there's any other risk factors or reasons to get them to the ER. But often there's not. Often the febrile seizures are very, very common. And especially young kids, they get those. And we just watch them and they usually do just fine. If it's a prolonged one or something else, or definitely call your doc and get to the bottom of it. This is not medical advice. It's not intended to be your personal medical advice. They're just tips and tricks of a family doc for mamas and families. So febrile seizures are really, really common. And what I do when a kid has a febrile seizure is I'll talk to the mom. We'll kind of evaluate the situation. If I can see him right away, we'll see him. And then if we can reassure ourselves that this is just a febrile seizure, then we will just mitigate that fever. So is there benefit in letting a fever burn, Tylenol, ibuprofening the fever, and dropping it? So which one's better? Do we let a fever burn or do we drop it down? And the data is that maybe it does help a little bit, maybe, but probably not. And it's okay to drop a fever. So that's the practical advice is, I think there's a lot of suffering that goes with a kid. If you've ever seen a kid with a fever, they're like miserable and it's brutal. And I'm like, why let them have a fever? Just like drop it down and they'll run around and play. And you would, with the running around playing activity, mobilizes lymphatics, fights infection. So just from common sense standpoint, I'm into dropping fevers. I'm okay with that, especially if you have a kid who's predisposed to febrile seizures. If they start getting sick, just alternate ibuprofen and Tylenol. Make sure it's weight-based or age-based. We always dose it based on weight, 10 milligrams per kilogram, and make sure you calculate that appropriately because they come in different concentrations and stuff. But talk to your doctor and they can help you with that if you're not sure how to do stoichiometry stuff. That's the fever situation. If you have febrile seizures or a kid who's predisposed to febrile seizures, definitely just drop temperatures and keep them down with ibuprofen, Tylenol, alternating one every 6 hours. So every 3 hours they can get one or the other. That's typical for that. When to go to the ER if it's prolonged. If there's no fever around a seizure, definitely take that kid to the ER. Seizures are not normal in children, super not normal. Febrile seizures can happen or can be normal, but a fever away from a seizure away from a fever is super not normal and needs workup. Let's go on to other common things. Nosebleeds. Super, super common and really common because kids are like, especially we live in all climates, it's common, but like in dry climates, like we live in Utah and it is just very dry here. And then we have the AC and the heaters that just circulate the dry air and dry it out even more. And we see a lot in the wintertime or in the spring as kids are like having just dried out noses. So prevention, I like to do like Vaseline in your nose, put a humidifier in the room. We actually put a humidifier unit on our HVAC system. So it just puts 30% humidity into the house and it's kind of nice. But you can get all of those kinds of things set up into your home. And the humidity definitely helps. Vaseline in the nose before bedtime will help. The nasal sprays are short-lived, so I prefer like Vaseline or Aquaphor or something. And you don't have to shove it way up in there. Most nosebleeds happen in the distal third of the nose. So like this part down here are squid bowels. And so if you do have a kid with a nosebleed, it's sometimes from picking. And if you think about picking, they're picking on that medial side of the nose. It's very, very common. It's like this nasal septum right here in the middle. And they might pick off a scab or just pick some boogers and then they get a little nosebleed. So to stop a nosebleed, almost all nosebleeds stop. There are rare occasions when a nosebleed can be up high and it can be very difficult to stop. And, in the ERs, we do all these tricks where we pack them and do all these, stuff. But in the home setting, you just squeeze it. So, and a lot of people were taught to squeeze the bridge of the nose, like up here where the bone is. Well, that's not doing anything. It's just a bone. And so just distal to the bone is kind of soft area. So you want to squeeze there. But if you think about it, you want to squeeze like the whole area. And you want to squeeze that whole thing. So get your fingers and flatten them out and just squeeze that whole area down distal to that nose bone. So if that's the bridge of your nose is that hard bone, distal to that or down from that, if you squeeze with your fingers, you're basically squeezing off anything that can bleed in that area. And squeeze kind of hard. A common mistake is people like put toilet paper in their nose, or they hold up too high on the bridge of their nose, or they squeeze too far down on just the outside of their nose. You gotta squeeze where the bleeding is happening. Any bleed anywhere in your body with pressure, most of the time will stop. Your body has internal mechanisms to stop bleeding, to create a clot, to hold that clot, all the things. Incredible. It's an incredible cascade to understand. So with a nosebleed, just squeeze. Don't keep checking. A lot of people, they'll squeeze for 10 seconds, they'll take their fingers off, and they'll check, and they'll look, and they're like, oh, it's still bleeding, and then they'll squeeze again, and then they'll open, and they'll check again. So that's not what you do. Just squeeze and hold, and just keep it on there for like 2 minutes. Just keep holding. You don't have to squeeze super hard, but you do have to squeeze reasonably hard. If their nose is turning purple, you're squeezing too hard. If it's like you're still bleeding, you're not squeezing hard enough. And so find that happy medium. What about head position? Do I tilt forward? Do I tilt back? Just look straight ahead. It's totally fine. You don't want to tilt back too much because if it's a posterior nasal bleed, then it can bleed down their throat. So maybe a little forward and just squeeze, and that'll be totally fine. And then you generally stop, no big deal, and it should be fine. If there's a consistent nosebleed thing, it's often from the dry nose, do the Vaseline thing, and it usually solves that. Again, not trying to give you medical advice, but these are like tips and tricks of an old family doc. I guess I'm a young family doc. Okay, what's next? Cuts, lacerations. If you have a scrape or a cut, number one thing is get yourself to safety. So don't lay there, just get out of the road or whatever, wherever you ended up. And then number two is like address the bleeder, right? So you've got a lot of blood coming on. Scalp lacerations bleed a lot. Facial lacerations bleed a lot. And so, they're very dramatic and they look all dramatic and stuff. And so number one is to stay calm because nobody's going to die from a laceration on their scalp. It looks dramatic. It's not dramatic. But definitely hold pressure. So what I do is first I, clean it out and tap water, like a whole copious amounts of tap water is great. You got a hose, you got something, just put some water through that wound. Scrape away any debris, any rocks, any stuff in there. Scrape. Let's just run the water in there. Do I need to put like hydrogen peroxide in there? Do I need to put soap in there? Do I need to put iodine in there? You don't have to put any of that stuff in there. Just water. Just rinse it out. Put a finger through it. Get any extra debris. Just rinse. Copious amounts. Do like a gallon, 2 gallons. Just rinse. Does it have to be sterile saline? No. The studies show that tap water versus saline, actually tap water does a better job. Why? This is a very common surgical phrase. We say the solution to pollution is dilution, which means you just dilute it out with a ton of tap water, and it's going to get rid of all the bacteria, all the dirt, all the debris, everything like that. So copious amounts, lots of water. Rinse out the wound first. In my office, they'll call or text, and I'll just get out there and just do the laceration on the 4th of July, and we just numb it, and then we clean it, and because it's pretty painful. And what I do is I clean it out with water, lots and lots of water, and then I might throw some betadine through there, and then water some more, and then I'll close it up. But if you're just out in the boonies, you don't have to do betadine. It hurts, it'll sting like crazy, so I numb it before I clean it. And that's a luxury of, having me available to folks and my team and all that at Voyage Clinics. But if you're away, just literally rinse it out, wash it out. Scalp lacs almost never get infected because they're so well perfused and lots of blood supply and lots of white blood cells and everything. So you don't have to worry too much about scalp lacs. By lacs, it means laceration. Sorry about that. That's slang. And so, so clean it out first and then hold pressure, stop the bleeder. If it's pretty deep and pretty wide, if you see little globules of fat, looks like yellow little globule, like chicken fat or something, then you're through the dermis into the subcutaneous tissue, and that usually requires closing for 2 reasons. One is to reduce the amount of scarring, so cosmetic and it looks nicer. And number 2 is close up that gaping wound. Our first immune system response is our skin. So it's our first deterrent of infection. And if it's pierced through the epidermis and dermis into the subq, then your chance of getting a systemic infection into your bloodstream, sepsis, cellulitis, vasculitis, can be really, really high. So we close those to prevent infection. So scarring and infection is mitigated with a closing of a wound. If you're out in the boonies and you don't have a doc accessible like we are, then you could consider a couple things to close a wound. Certainly just a dressing, wrap it around. You don't want to wrap it too hard to asphyxiate or decrease blood supply to the wound edges. So that's a danger. I like to use benzoin tincture, and in one of my short podcasts or short clips on my YouTube channel, Voyage Clinics, there's a little thing about this. Put this in your first aid kit, and it is Steri-Strips with benzoin tincture. Benzoin tincture is a topical tactifier. You can just put it on the edges of the wound. It makes it sticky, and then you can put a Steri-Strip. You can buy these over the counter. They're kind of like the butterfly bandages, but I like them better. So put a Steri-Strip on one side of the wound and then pull it closed and stick it to the other side. Blot any blood away. Do the opposite. Put it on the upside of the wound, pull it down, stick it to the other side. So you're kind of creating opposing Steri-Strips, one this way, and then do those 1 to 2 millimeters apart. With the benzoin tincture, a Steri-Strip will stay on a wound for a long time, like 7 days. And really, you only need 72 hours or so for that to start knitting together. Tension on wounds matters. So if you get a wound on your arm or your leg, that skin is pretty tight. And if you cut it, it automatically opens up really wide. And so those almost always need stitches to maintain a closure. You won't get a good closure with Steri-Strips on that. But for a little while, you could put a Steri-Strip on that until you can get to see your doc. You have about 18 to 24 hours to get a wound closed. So it's not a super emergency, but call and try to get in within a few hours to the next day, and then you can get that closed. As long as it's not bleeding profusely, again, put pressure. You'll be surprised what you can stop as far as bleeding with just pressure alone. Like you'll be like, whoa, this will never stop. Pressure alone, and it will stop. It's amazing. Again, clean it first. So clean it, pressure, bandage, and then try to get in for a closure if you're able to. That would be super great. If it's on a loose skin area, like, the skin is pretty loose and the neck has some loose spots. There's different spots in your body where the skin's pretty loose, or it's not that very deep, or it's not very wide. Certainly you could try the benzoin tincture and Steri-Strips. It's wonderful, and it closes lots of wounds really beautifully. Again, make sure it's clean, and that'll work out really great. Anything else about wound? Oh, scrapes and things like road burn, really common, brutally painful, and very difficult to clean. The epidermis is that outer layer of skin, and that's where all your nerve endings are. And that's why road burns hurt so bad. I can feel it right now. I've had many times road burn. And so what do you do there? If it's a deep road burn and there's gravel and junk throughout, honestly, call your doc at Voyage Clinics, or call Voyage Clinics, and we'll get out there and we'll clean it up. try to get to somebody, because we got topical numbing stuff, and then also we'll do injections. We'll numb it all up, and then we actually scrub it. We have this like really soft bristled scrubby sponge that we scrub out all the debris and all that crap and stuff, and it's just easier. Otherwise, you can get some retained like almost like a tattoo from the environment, like if it's dirt or like some asphalt or something in there. And then also you can have retained rocks and things like that in the wound as well. So just come in, let us numb it, and then scrub that sucker out. That's the best way to do the deep road rashes and stuff like that. I think that's about it for wounds and stuff. You want to change dressings on wounds. You want to change them about twice a day, more frequently if they get wet or they get sweaty or they get dirty. Change them more frequently, but you don't want to, change them every 2 hours or anything like that. Just keep them on. I really like bacitracin for topical application on wounds. Vaseline works. Bacitracin works. Triple antibiotic has neomycin in it. Also did a podcast on this. Don't use the neomycin It just, some people create an allergic reaction to it, and it looks like infection. It's not infection. So I don't like that one. Hydrogen peroxide, one of my most viral videos was this, don't use hydrogen peroxide thing. And it's true. Hydrogen peroxide is cytotoxic. It kills the cells. That's why the bubbling, it's actually killing cells. People think it's cleaning wounds. It's not. And so experiment if you want to. Try dipping your finger in hydrogen peroxide, pull it out, and it turns white. That's actually oxidative damage on your skin. And so avoid the hydrogen peroxide. And I'll know I'll catch hate for that because I have on my previous video, but that's okay. No doctor uses hydrogen peroxide. We don't do it. Sometimes for an acute bleed, hydrogen peroxide can actually help shut down some bleeding, but honestly, pressure and time is best way, and clean it. Don't worry about the peroxide thing. Okay, that's probably it for cuts. Let's talk about burns. Let's talk about sunburns first. Really common summer thing. You've got sunblock, you've got sunscreen. Sunblock is like, it has UVA and B in it. Sun has UVA and B, and sunblock blocks both. Sunscreen only blocks one. And I guess there's misnomers out there on both of those. So we'll just skip calling it sunblock and sunscreen. We'll just say any sunblock that has titanium in it or zinc. So zinc oxide, titanium oxide, they put this in there. It's a metal. So if it's got a metal, it's probably going to reflect all sun UVA and B. UVA is causes aging. You've seen those like leather looking sun babies. And then UVB causes burns. So often the spray-ons, they just prevent burning, but they won't prevent the aging. And the UVA, which is the aging one, also contributes to, skin cancers and things like that. So definitely use one with titanium or zinc oxide to prevent the sunburn. How much sun is enough sun? It depends on your skin type to get enough vitamin D for the day. So the darker you are, you can probably tolerate more sun. The lighter you are, you don't need as much sun to get the vitamin D you need, probably roughly 15 to 20, 30 minutes, depending on the time of the day, the UV index, all those things. And those are things you can easily look up on, or ChatGPT, that stuff. But don't want to do too much sun, you'll start getting burned. And definitely use the sunblocks with UVA and B protection. Okay, other burns. So there's first degree, second degree, and third degree burns. First degree is just like a little pinking. It just hurts a little bit and it's done. Second degree, you're getting blisters. And we've all had sunburns with blisters. Those are really bad second degree sunburns. Try to avoid those. Any burn that starts to blister, you're going to need some wound care afterwards. The first degree burns are just a little pinking. They hurt and then they go away and it heals up and almost never causes any issues. And what else? Yeah, I think that's about it. The burns should be second degree burns. You got to look at wound care. I like to cool off a burn. And so a lot of old wives' tales back when I was a kid, my mom used to put butter on my burns. That's a bad idea. But you just want to cool them off. So I've had some bad sunburns back when I was a kid and literally just alternated ice packs and it stopped the burning because that burn continues all night if you burn during the day. So you got to really cool that down as fast as you can. And so that's really helpful for first degree burns. Second degree burns also have a burning post facto effect. And so cooling those down is very helpful. But then you want to address the blisters. You want to address all those things as well. And so usually with that, we don't usually use jellies and those kinds of things, especially immediately after because the burn is happening and then the oils are hitting the skin and they're just continuing to burn. So cool it off. Use cool compresses. You could use ice on a wet towel or something like that. That's what I use. And then address the blisters and those kinds of things. Do you pop a blister? Maybe not. Leave it on. It's like a protective layer. But once it does pop, don't de-roof it. Don't take the skin off. Leave that skin on and then let it sit there until the underskin can heal up and recover, and then it'll slough off on its own. It's best to do that. There's all kinds of things. Silvadene. Silvadine's a burn cream that we've used for many, many years in medicine, and it is appropriate sometimes. And talk to your doc about a prescription there because it is a prescription. But honestly, it's not always needed, and there's some studies out there showing that sometimes it inhibits healing. So it has some silver in it, which prevents infection. So for probably worse second degree burns, I'll use it. If it's just a mild first or second degree burn, I almost don't use it. Third degree burns are where you get charring of the skin and permanent death and badness. Those are bad burns. Those almost always need to be seen by a healthcare professional for sure. So those are ER situations. Go to the hospital, get taken care of. The scary thing about third-degree burns and even some second-degree burns is you lose a lot of water, a lot of fluids, and it's often people die from dehydration. And so you gotta rehydrate those people. So stay really well hydrated if you're getting lots of sunburning, because all that is like a fever, and like fevers, you lose a lot of fluid through a fever as well. And so stay on the fluids when you're doing that. And in the hospital, we actually put a bunch of fluids into these people, especially third-degree burn people. Yeah, that's probably it with burn stuff. Mm-hmm. Yeah. Bumps, bruises, and injuries. Let's talk about those. Very, very common. And, when do you decide, is it broken? Is it not broken? If they're not using it, right? Kids are pretty good at telling you what's going on. And they're not often vocal about it. Like small kids who can't talk a lot, you just watch them. And if they're not moving an extremity, it's probably injured. And so it's worth looking at that. Any bumps, bruises, those kinds of things, you can put ice on them for the first 24 hours to kind of cool them down. Take anti-inflammatories, those kinds of things. Rest it, I don't like the heat thing. I don't think it's helpful at all. It creates more inflammation, more vascular supply, and all that stuff. And the ice thing, I wouldn't do it prolonged. So depending on where it is, I wouldn't do it for more than 20 minutes, 25 max on like bigger places like legs. If it's on a hand, maybe even less, 10, 15 minutes. For head injuries, you're going to look at that's a whole nother discussion, by the way. We probably shouldn't even get into it, but concussion stuff is real. Confusion, agitation, stuck in a mental loop and an emotional loop. Certainly dizziness, vomiting, headache. Those are all symptoms of a concussion. I can't read. Sensitive to light and sound. Those are all symptoms of a concussion. Head trauma is a big deal. Definitely get evaluated if you get some head trauma with concussion symptoms. There's some concussion rehab things that we can do now, and there's all kinds of really great protocols for that. And so I think, you get head trauma, get seen for sure. I want to pivot a little bit to allergic reactions. Very, very common. There's 3 tier of allergic reactions. There's just a little skin rash, not a big deal. And then there's hives, systemic hives all over my body. That's a systemic thing. Yeah, I either ingested something or there's something all over my body that is creating hives, and pretty significant allergic reaction. The third and most serious type of allergic reaction is involving the mucous membrane. So we're talking like anaphylaxis stuff, like maybe my eye is swelling, my mouth is swelling, my mucous membrane of my mouth is swelling. Those are big deal things because it can swell into your mucous membranes of your throat and close off your airway, and then you die. And so if you have a near anaphylactic or even just hives reaction, your next reaction to whatever you got exposed to can be much more profound. So like bee stings, for instance, you might initially just have a little bump at the site of the bee sting. No, there's no big deal. That's a normal response to the venom. The next time it might be hives everywhere. Oh, that's a big deal. That should be a red flag. Talk to your doc, because I almost always give those people EpiPens, because the next time they get stung with a bee, they're getting throat involvement, anaphylactic stuff. And then what do you do? So let's talk about anaphylaxis, because that's the most serious one. People die. I'm getting some airway involvement. My eyes swollen, my lips swollen. I can't talk really well. Having some issues with my throat, breathing wise. Those are all symptoms of anaphylaxis, and you need to get seen right now. So step number 1, EpiPen. Boom. Just take the lid off, hit it right through your jeans. You don't even have to take your pants off, nothing like that. The needle is massive. It's designed to go right through clothing. Hit the button, and you're done with that. Once you get epinephrine in there, what is that? Well, it's designed to mitigate all inflammation in your body, stop that swelling process, but really short term, just to get you to the hospital. So keep your second EpiPen nearby and get your butt to the hospital. If you start to have more airway involvement, what do? Same thing, other leg. Stab your leg with the EpiPen, take the lid off, stab it, press the button, and it delivers the Epi and keeps you safe until you get to the ER. Some people make the mistake of taking an EpiPen, take a Benadryl, try to self-medicate. It's going to be fine. Everything's going to work. Don't do that. Get your EpiPen. If you need an EpiPen, if you've used your EpiPen, you have to go to the hospital. It is 100% necessary. So that's super important. Now, back up. Let's go to the less serious, maybe the second most serious, which is hives. You can take some Zyrtec, Benadryl, Claritin. Take something like that. Age appropriate, all the things, dose it appropriately. And call your doc, text or call your doc like we do at Voyage Clinics. They're like, hey, I'm having an allergic reaction. This is what's going on. We'll help you navigate that situation. No sweat. The third one is just like a little itchy rash thing. Those are almost awesome with just a topical steroid or something like that, and then avoiding whatever it was that gave you the rash. And so, yeah, those are the allergic ones. Those are the big players. To detect allergies, it's not that hard. There's all kinds of little allergy testing protocols out there. You can check IgE. It's a blood test. And I think for peanuts, an IgE is like $5 at Voyage Clinics. And so we can easily screen you for all kinds of things. We can get a very comprehensive food allergy panel for like $80. But yeah, I think keep a food journal. If it's a food allergy that you're having, keep a journal and then, give me a rough estimate. It's either bananas, it's either almonds or walnuts. Okay, great. Let's just check the food panel with those three in it and a few other things, and we'll see what all he's allergic to. So that should help out quite a bit too. I want to talk a little bit about croup, because I've seen 3 cases in the last week. So breathing issues in croup and respiratory distress. So let's talk about breathing stuff, because that's really important. So any child or adult can have an exacerbation of airway inflammation. And it can just be reactive airway disease, or if you have a history of asthma, it certainly could be asthma. Both of those can be life-threatening, and you'll feel a tightness in your chest. You'll see maybe your kid start to have what's called increased work of breathing, WOB. We often abbreviate things in medicine, which are dumb, WOB. So increased work of breathing, they may be using accessory muscles. You'll see their neck kind of flexing as they inhale. They might raise their shoulders up like that, and they're kind of working to breathe, and you'll see them moving, and you'll see neck flaring, flexing, nasal flaring. You'll see the tummy kind of working to breathe. Sometimes in small kids, you'll see rib retractions. I won't take my shirt off and show you what that looks like, but it's the skin underneath your ribs kind of puckers in as they're breathing, and that's like really working to kind of suck air into their lungs. I just saw a kid with all those symptoms yesterday, and we got him handled. They brought him right in. They texted me, said, this is what's going on. They showed me a video. I said, I need to see that kid. They brought him right in, and we got him squared away. Otherwise, that's an ER visit for sure. I'm a country doc, and I've worked in ERs and all that, so I'm very comfortable managing all that stuff. But not everybody has as good access to medical care as we provide at Voyage Clinics. So sometimes the right answer is go to the ER, because if you can't get a hold of your doc, you got to go. So this kid did great. And he was having like a reactive airway disease. He has like one every 2 or 3 years like this. Does he have asthma? No, he doesn't have asthma. Although he was wheezing and all the things, he sounded like asthma to me. But because of the frequency with which he has these exacerbations, this is considered reactive airway disease, and which he'll probably just grow out of that as he ages. Croup is a pharyngitis inflammation, so it's a specific virus that like causes inflammation on the airway down lower. So it's not going to cause your typical runny nose and sore throat and all that stuff. It's just going to cause a closing of the airway. And kids that have that, you'll hear them breathing, and they don't have any wheezing in their lungs, but it sounds like they're wheezing, but it's just coming from their throat. And so they're just closed down in their throat, and you can kind of hear it. They call it like an inspiratory stridor. So it sounds like this. And it's pretty common. You'll sometimes see the throat tissue kind of pucker when they're breathing in and stuff like that. A consistent stridor, inspiratory or expiratory, is grounds for taking your kid to the hospital. So if it's just once in a while, like cry, inspiratory stridor, no big deal, especially if it's not at rest. But if it's a consistent, every single time they breathe, they're having inspiratory stridor, that's a big deal. So look for that. If the kid is breathing rapidly and working to breathe, that's another reason to get that kid to the hospital, get them seen, or to my clinic, get them seen by me. Like, I'm happy to see those kids. But But yeah, we need to get those managed right away. And we do medical things for that. So we have inhalers, we have steroids, we have all these things that we do to kind of open up their airway and keep them alive until they can fight the infection, and it's fine. With croup, we just give them like one dose of an oral steroid, and it usually calms it enough to where they can ride through that and be fine. Rarely nowadays do people need to be hospitalized with croup, although those are the signs that they might need to be if they have a persistent stridor. I think that's about it. Yeah. Oh, just push me back to the babies. So infants less than 8 weeks, fever, and you don't have any other symptoms. Less than 8 weeks. My rule for my patients is if you're less than 8 weeks and you got a fever, you got to go to the hospital. There's just too many things that could be wonky there. And neonatal sepsis is the most concerning, and it's really, really, really bad. And so less than 8 weeks old with a fever, get them to the hospital, get them seen by somebody right away. We're covering a lot of ground. I think that might be enough. I kind of want to go over some stings and bites. Let's do it. So wasp venom, bee venom. We talked about anaphylaxis with bee venom. If you have just a bite and it's just a little bit swollen, that is no big deal. You can put topical Benadryl on that. You can take an oral Benadryl or Zyrtec or Claritin. It will help. But the venom just has to break down. It'll be painful. It'll take a few days. It'll be fine. Remove the stinger if it's a bee sting, especially. Sometimes the stinger's still in there and it can cause infection and stuff. So just scrape it away with like a credit card or something. Get rid of that. And then, yeah, that's that one. In Utah, we don't have Lyme disease yet. So if you got a tick, it's common with camping and get a tick on you, just remove the tick, grab it as close to the head as you can with a small pair of tweezers and just gently pull, gently pull. Don't grab it by the bum, especially if it's engorged, and don't squeeze real hard because then it's like getting all that stuff in your bloodstream and stuff. So just grab it by the head as close to the head as possible and gently pull. It will release and then it will let go and it'll be done and it's no big deal. Don't pull really fast. Don't grab it by the back and pull really fast. Just pull really, really slow and it'll be like, hey, who's pulling on me? What the heck? And then it'll just unscrew its little head and pull out and it'll be fine. Don't screw them. You don't have to screw them either way. You don't have to do that either. If you develop I had a kiddo a few years ago. He had a tick on his head, giant engorged tick. We would safely remove the tick, but he developed a fever. And so I spent a lot of time on the phone with like infectious disease at Primary Children's Hospital in downtown Salt Lake. And then also the health department, tick specialist, and all these different people. And I learned a lot of cool things. So, Borrelia burgdorferi is the organism that causes Lyme disease. And Lyme disease is a very serious tick-borne disease that can cause like neurologic deficits, all kinds of systemic symptoms if you don't treat it. Are there other Borrelia? Absolutely. There's Borrelia. There's a whole bunch of different little Borrelias. They're all spirochetes, which means they're kind of spiral-shaped little organisms, and they're intracellular parasites. So they live in the ticks. The ticks are the median for their passing, and then they can get injected into our blood cells, and then they can infect us and cause all kinds of systemic infections. We just treat that with doxycycline. It's super easy, and you can just treat it for 10 days, and then it's done. 20 days if it's like more chronic, but like usually just that's enough. And those are prescriptions. Talk to your doc if you got Lyme disease. If you're traveling, you probably got it. I learned from the tick specialists in Utah people. They scrape the tick infected areas. They just scrape all the tick beds, and then they grind it all up and they throw it all through a PCR machine at polymerase chain reaction. And so that allows them to just take and see if they have Lyme disease in Utah yet. And we have not yet found it in Utah, which is significant. I mean, doesn't mean you can't bring it back to Utah from like the Midwest or the East Coast. I trained on the East Coast. We saw Lyme disease quite a bit, and we just treat it. It's no big deal. So there's that. Now this kid, back to my story, he ended up with a febrile illness after a tick, and he had all the things. And I was like, whoa, does this kid have Lyme disease? And the answer was probably not, but he definitely has one of the Borrelia guys, right? One of the spirochete parasites. So we just treated him, and it was fine, and he did great. He's doing awesome to this day. yeah, I'm not going to get into snake bites. That's a whole nother thing. There are spider bites. That's a whole nother thing too. So I think we're just going to, for the sake of time, call it a day. This was good. I hope this helps you. First aid is really important. It's good to stay calm, stay cool as a cucumber, and help your kiddos. And it's really nice to be able to text or call a healthcare provider like at Voyage Clinics to help you manage and navigate these really high stress situations. I think in medicine, we deal with so many high stress situations in the ERs and the, really scary things that we're good at staying calm and treating the right thing the right way in those really scary situations. And not everybody has that. And so it's totally fine. Reach out. We'll get in touch with you and it'll be super great. Hope this helps those mamas and papas and families out there. And don't forget to like and subscribe. Take good care of your families. Dr. John at Voyage Clinics. And thank you for listening.